Hello from the Dukascopy TV studio in Geneva. We're talking about advancements in healthcare and especially in the radiology sector with Mr. Markus Orr. He's Managing Director of ImageRive here in Geneva. Welcome, Mr. Orr, to the studio.
Thanks for having me.
So, can you present ImageRive in a nutshell? What do you do and where are your specializations?
Yeah, sure. Well, we are a private radiology company. We have two institutes in Geneva. We have ImageRive, which is in the center of town, Rue de Rive, and we have the radiology department of the Clinique La Colline, which is something we took over in 2004 from the Clinique La Colline. We work in partnership with the clinic, which is a very old and famous clinic in Geneva. And ImageRive, which was the first institute, we founded in 2003, 12 years ago. And so what else can I say? We have 55 employees, we have 12 doctors, 12 radiologists, and we do around about 70,000 radiological exams every year.
Mm-hmm. So radiology resembles one of the biggest advancements in healthcare of the last years. So can you give us an overview what innovations have been made in the recent years and how patients can benefit from these advancements today?
Mm-hmm. I think that the really big groundbreaking innovations in radiology came back in the 70s and the 1980s. In the 1970s, we started to buy the CT scanner. It came out as a new equipment. And in the 1980s, we started to buy the first MRIs, the magnetic resonance imaging. And since then, if I'm honest, the last few years, just looking on the equipment side, I think that we haven't had these groundbreaking new equipment, but what we have seen is that the CT scanner and the MRI in particular are getting much stronger, much more powerful, and they're able to produce much better image quality. And so what I would say is that it's rather banal perhaps, but I think not for the diagnosis. When we get a new machine now, in comparison to even just 6 or 7 or 8 years ago, the radiologist will notice a very big difference in image quality. And that's one of the reasons why we do renew our machine park a lot. We look at this a lot. And just to give one example, I have someone in my near family who lives in France and went to their local radiology 2 years ago, and had a question, wanted a second opinion on some images and gave it to me to give to one of our doctors. And the first thing they noticed when they looked at, they were images from today and then the comparative from 2 years before. And the first thing he noticed was, they've changed their machine in between. And so he said straight away, this was an old machine, and this one you can see is the new generation. And then he concurred with the diagnosis which was made the second time, and said that this could be made with much more exactitude than before. So I don't think that counts as an innovation, but I think that the changes in image quality, because the machines are much more powerful, that is very important, something that has been very important over the last 5 to 10 years. Other things that I think we have to talk about is, for example, the tunnels in the MRI are becoming bigger, and this is important because I don't know if you've ever been a patient in an MRI yourself, but for some people, when you get in, it can feel very, very constrictive, very uncomfortable to be in a tunnel. And so the more room you have, the wider it is, the more space you have. I think that makes a big difference to patient comfort. And the other thing I would mention is we have made strides in the last years, in particular in the reduction of radiation dose. This is very important, I think, in our screening programs. At ImageRive, we do a lot of women's breast screening. And I think it's very important to continue to do that. 1 in 8 women in Switzerland will at some point develop breast cancer, and it is so important. If it is detected early, there is very good chances of having a good treatment and of everything going okay. But of course, one of the things that we have to say is, in a screening program, we are sending healthy women to find out if they may have breast cancer. And so one of the biggest concerns we have is we obviously don't want to expose healthy women to a possible radiation dose. And so that's why and I think we were one of the forerunners in Geneva in this, We already in 2008 and 2009 got new low-dose mammograph, and we now have the lowest dose, certainly in the market in Geneva, for the woman's breast screening. And I think that's a topic that has really come in over the last few years, and I think it will continue to do so.
Mm-hmm. Where do you see Switzerland standing in the healthcare or like radiology field especially?
I think Switzerland is quite in the forefront, actually. In terms of technology and advancement in radiology, I think we definitely have, I mean, the USA is the leader still, that is clear. But Switzerland, I would say, is in the top 5. And I think we have a lot of very, very advanced equipment. We still have quite high health insurance premiums, which means we are able to buy these very expensive machines. In some countries, of course, you have a centralized health system. The government decides, and the government must also then, because it decides on everybody having the same treatment, it needs to put a lot more pressure on the prices which the health companies can then have for their exams. And there is a lot to be said for that view, but one of the problems it then has is it puts a lot more pressure with the price. A health company that is earning much less on each exam is not going to buy the latest equipment, and so that is something that we have been able to do in Switzerland. We have been able to keep up with the latest developments in equipment and radiology.
Do you see the health sector becoming a market similar to the USA in Switzerland, or other way around? Sort of, is the pressure from insurances like on the costs heavy here?
Yes, the pressure from insurance companies is heavy, but I think that they're doing their job. I think their job is, and that's quite right and correct, they want to make sure that the premiums that have been paid, that they are respected, and that they only reimburse the actual things they have to reimburse, and so they have to exercise that control on the system. I think that comparing the Swiss system, the Swiss system is interesting because it is one of the few European systems where it is like a private health insurance. It is not like most of the markets, my own country, United Kingdom, or the Scandinavian markets, or France, or even Germany. It is a system with private health insurance. The difference to the USA is that poor people here will get access to the public hospitals. So there is not the same, and I think this is something we all feel, it is so important for people, whether you're rich or poor, you have to have some standard access to basic health services. If you are sick, you must be able to be treated. And this is the case. In the USA, it's mostly not the case. Apart from, I think they do have some community hospitals, I have heard, for people who don't have medical insurance. But I've heard that the quality there is third world standards. So we thankfully don't have that system in Switzerland. We do have a private health insurance, which I think is a good system. But we do have a kind of a safety net for people who really cannot pay.
Mm-hmm. Thank you very much. And so finally, what challenges or also future outlooks do you see in the healthcare field here in Switzerland? What are you particularly looking to when you're looking for the next, say, 10 to 15 years?
I think that the things we're looking at in the future, certainly radiation dose reduction will play a further big role. It already has, but I think this will come even more. I believe that the other thing that we're looking at is smarter IT systems, in particular how we can use smarter IT systems to help our doctors. I'll give you an example. In breast screening, for example, we may have thousands of cases that need to be read by the radiologist. And I think going forward, there are already programs that can do this or can start to do this, but I think this will increase, that if we can use a very smart IT program to already filter out the cases that need to be looked at, we can free up the radiologist to devote more time to see the patient, to talk to the prescribing or the referring doctor, and to be able to look at those reads that are really important. And that's something that I see more and more going forward.
Thank you very much, Mr. Markus Orr, for being here today and sharing this information with us.
Thank you very much for inviting me.
And thanks for watching. Do make sure to keep clicking back on the Dukascopy TV website for latest updates and exclusive interviews. Have a great day and see you next time.